The pathological disease I chose is anxiety. There are 6 types of anxiety. Anxiety is a mental health disorder or a nervous disorder. Most of the time, it affects your ability to live a normal life, and it can be self-diagnosed. The 6 types of anxiety are generalized anxiety, social anxiety, panic attacks, obsessive compulsive disorder, post-traumatic stress disorder, and phobias. Generalized anxiety disorder is just general anxiety where a person just feels anxious all the time and worrying about everything and anything. It can last a period of 6 or more months. Social anxiety disorder is an intense fear of being embarrassed, humiliated, or even criticized in everyday situations where people could do normal things like go to the store, small talk, being able to assert yourself, speaking in front of crowds. People with social anxiety have a hard time dealing with this. It's one of the hardest anxiety disorders to deal with because it interferes with everyday life or any situation where people are involved. Specific phobias, where there is a specific object or situation that makes a person feel fearful and they will do anything to avoid it. An example is being scared of clowns, being scared of needles, being scared to even step foot on a plane. Those are all really big phobias that people have. Post-traumatic stress disorder. This can happen when you experience a trauma or have a really horrifying experience. People who have been in war, doctors, police officers, all may experience PTSD after seeing all those people die or dealing with very scary situations, but especially death can really bring about PTSD. People with PTSD can experience very troubling flashbacks, which can even cause panic attacks, which will feel like a heart attack. Obsessive compulsive disorder, the constant, unwanted, intruding thoughts that keep coming back. People with OCD, they need everything a certain way when they're cleaning, organizing. It could be any little thing. They have obsessions and they just have to have everything in order the way that they see it. Some people have a fear of germs and they constantly keep washing their hands. It's like an obsession. Panic disorder, which are panic attacks. They're uncontrollable, intense anxiety with physical symptoms. A panic attack can feel like a mini heart attack, and sometimes people may not know that they're having a panic attack. Could be mistaken as a heart attack. If you fear having a panic attack and you have at least more than one a month, you most likely have a panic disorder. Anxiety affects men, women, children, pregnant women, elderly people. Anxiety doesn't have any specifics to gender, to color, to race, to age. Anyone can get it. Anxiety has 3 main factors: psychological, biological, and social. The psychological refers to the environment and everything around us. Biological is genes, traits you can inherit genetically. For social, it's interactions with people. It can be set off by psychological vulnerabilities, especially the past. Genetics and anxiety. Genetic vulnerabilities can come from a passed down personality type. You can get the gene where you are extra sensitive to stress and you might be more reactive to it. It's still well under investigation and they're still studying it, so they don't really have any specific genes that are linked to it yet. If you are 20 years or younger and you have a relative that has it and you have it, you most likely could have got it from somebody in your family. There's 6 systems relating to anxiety: the nervous system, cardiovascular system, respiratory system, digestive system, excretory system, and endocrine system. The nervous system is the command center. It directs and dictates all the other systems. The limbic system contains the hippocampus and the amygdala. Okay, so it starts with a certain part of the brain called the limbic system. The limbic system has the domino effect that's responsible for emotions, with many structures inside, including the hippocampus and the amygdala. The part of your brain that perceives danger and lets the rest of your body know is the limbic system. The part of your brain that has memory and activates the anxiety, but also initiates past memories that may bring on anxiety, is the hippocampus. The amygdala regulates emotions like fear and detects possible threats in the environment surrounding you. In addition to the amygdala, you got the hypothalamus, responsible for controlling autonomic nervous system, made up of two parts, the sympathetic and the parasympathetic nervous system. The amygdala is a fight or flight message to the autonomic nervous system in regards to anxiety, which is a major role. Just like a light switch, only one can be on at one time. This is a picture of the fight or flight. Fight, stand your ground, defend your position, attack, dig in, persevere. Flight, give away, retreat, discard, remove yourself, give up, move on. The autonomic nervous system has two branches, the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is the on switch for the flight or fight response, and the off switch is the parasympathetic nervous system. Makes you feel more comfortable and relaxed. This is just a picture of how it works. The cardiovascular system, the sympathetic nervous system gets the cardio system going in the body. The heart starts racing, the body needs more oxygen, less blood flowing to the brain because it gets more blood flowing in the body to other parts that actually need it. So it kind of turns your brain off. Makes you feel lightheaded, nauseous, dizzy. The respiratory system, increased blood and increased oxygen makes breathing heavier. Anxiety can lead to hyperventilation or overbreathing. It reduces carbon dioxide in the blood. It can make you gasp for air or make you feel like you have pins and needles sensations. The excretory system causes the body to perspire more and cools the body down, which is actually good. The digestive system, it turns it off. It causes gastrointestinal problems like diarrhea, nausea, stomach pains, makes you feel not so hungry. The endocrine system communicates through two chemical messengers, hormones and neurotransmitters. Adrenal glands release adrenaline and noradrenaline, works together to increase blood pressure and heart rate. Their neurotransmitters is the part that it's the brain's communication system. One nerve communicates with another by telling it what to do. You can also find serotonin in there, which is the part of the neurotransmitter that it controls eating, sleeping, how you feel. So low levels of serotonin makes higher levels of anxiety. Signs and symptoms of anxiety. One symptom always remains the same for all 6 types of anxiety, which is severe or persistent fear. Emotional symptoms could be dread, can't concentrate, feeling jittery or tense, irritable, restless. Your mind feels like it's gone blank, and your anticipation is the worst. Physical symptoms, sweating, pounding heart, upset stomach, dizziness, shortness of breath, diarrhea, tremors, twitches, muscle tension, headaches, fatigue, insomnia. Treatment for anxiety. There's 6 main types of therapy. There's cognitive behavior therapy, which is the #1 recommended. There's exposure therapy, emotional therapy, mindfulness training, behavior modification. So the two best types is cognitive behavior therapy, which is when they focus on your thoughts and behaviors. It's meant to challenge all your negative thought patterns, and irrational thoughts that cause your anxiety. And for exposure therapy, helps confront your fears, but in a controlled, safe environment. The whole point of exposure therapy is to get a better sense of control. They will have you repeatedly face your situation or object and try to show you how there really is no harm in it. When you have anxiety, they say to stay away from caffeine and alcohol, or at least reduce the intake, because it actually makes your anxiety worse. Medicines to help treat anxiety. There's benzodiazepines, which is Xanax, lorazepam, Ativan, Klonopin. There's SSRIs and antidepressants. Paxil, Lexapro, Celexa, Zoloft, Prozac. SSRIs stand for selective serotonin reuptake inhibitors. Short-term effects: skin conditions like hives and eczema, difficulty breathing, blood pressure problems, sweating, twitching, fatigue, muscle tension, irritability, nausea, and dry mouth. For girls, changes in menstrual cycle. Men may have problems ejaculating, and both sexes have a decreased sex drive. Long-term effects: the breakdown of communication between the various aspects of immune system that occurs during the times of chronic stress may also be responsible for triggering flare-ups of various autoimmune diseases such as Crohn's disease, psoriasis, rheumatoid arthritis, lupus, multiple sclerosis, and other similar conditions. An autoimmune disease is one where the body immune system gets confused and starts attacking the body's own healthy cells instead of what it should be doing, which is attacking foreign disease-causing bodies. You need to make sure you are exercising and eating right and getting a good balance of everything in life to stay well and mentally and physically. With anxiety, you especially want to make sure you are getting enough sleep. You need to see a doctor if you are feeling super anxious. With anxiety usually comes depression, and neither one is any good. When you have a good balance of everything in life, it helps to reduce stress, which reduces anxiety. And also, if you have a good balance and you're still feeling really anxious, it's a good indication that your problem may actually be a little more serious. If it's affecting the way you live every day, then it's definitely recommended to see a doctor, and they can go about how to help you and treat you. Conclusion: the pathology of anxiety is much more complex than most people know, and I think it's so important for people to learn what it's all about. So many people have it, and it goes undiagnosed, but wonder why certain things are happening to them, such as panic attacks. It's important to get it under control so that it doesn't affect your life. Before I knew what was going on with me, I had bad panic attacks and became very antisocial, avoiding situations with people, like even going to the store. Even going to the store was something that I had a hard time with. And now that I'm treated for it, I've been functioning in life a lot better, and I can actually go to the store and be okay and not be scared to interact with people, and it feels great. And this is the reference page. Alright, and that's my pathological disease, anxiety.